Checking. 1, 2.
Right, good afternoon.
Eric Gutierrez.
Present.
Present.
There you have a quorum.
Thank you. Moving on to agenda item number 4, the approval of the minutes. Is there, we'll give everybody a chance to review the last month's meeting, the January 15th meeting. Anybody has any discussion?
The chair. And it's be accepted as published, and if any exceptions be placed on the afterwards.
We have a motion from Commissioner, second from Commissioner Patton. Before we move to vote, do we have any public comments specifically on the approval of the minutes? Nothing online either? So now can we move to
Eric Gutierrez.
approve?
Commissioner Crooks.
Approve.
Commissioner Palmero.
Approve.
Commissioner Jackson Kelly.
Approve.
Commissioner McFadden. Commissioner Fulmer. Commissioner Emmons. Commissioner Noyola.
Approve.
Motion passed. Thank you. Right, so moving to agenda item 5. All right, so the notice of today's meeting went out. There is a email subscription for those that have not received it. A lot of the things that we're talking about on this slide, you can find on the MVA website. You can sign up for the email subscription. There's a footer at the bottom, and click on the Let's get the latest updates, and that'll keep you updated. Public comment forum is also located there in that section. When you sign up for the public forum, receive an update on that. Hopefully later on in the director's report about that. And email to MVA today. There's an email distribution list that goes out. It's that you can sign up for there as well. That's it for the commissioner report for this meeting. Any public comment? Any public comment online? Public comment online? No.
Yes.
Oh, we have one. For public comment, you will have 3 minutes. Please go ahead and get whenever you're ready.
Good afternoon, everyone. This is Dr. Joshua Bamberger. I'm the former chair of the Services Committee of the VCOAB in Los Angeles, and a physician who cares for our veterans with a history of homelessness here in San Francisco, California. And I just want to comment on the idea about the Pacific branch and the relationship between what's going on in the West LA campus and what we have created here in San Francisco at the Presidio. And I think the opportunity to use the Presidio in San Francisco as a model for success in Los Angeles is one that you should take seriously. And some of the components of what makes the Presidio work so well is that it is a mix of a private and public partnership, in addition to having permanent supportive housing for veterans who've experienced homelessness, as well as having a sense of community and meaning and purpose for many of the people who both live there and use that space to expand their opportunities for well-being. So using the experience in the Presidio as a model for what's going on in West LA, I think would be a great idea, especially if you can get other components of the federal government involved to run the facility rather than relying on the VA, which has no track record of being a housing development and purpose development opportunity for veterans. That's about all I wanted to say, and I wish you all the best of luck to create the opportunity for every veteran in the Los Angeles area to thrive and to leave homelessness behind. Thanks a lot.
Thank you. Moving on to agenda item number 6. Agenda item number 6 is general public comment. Do we have anybody in person that would like to make public comment? You have the list?
Hello and good afternoon. My name is Daryl Crutchfield. I signed up to be on the list, so you should find my name. My name is Daryl Crutchfield. My organization is called LA Jets Veteran Support Group. I brought a comment as well as free resources and services for veterans. And what I'm doing right now is a TV show and concert, which is going to be raising money for veterans and Veterans Affairs. It's called Military Battle of the Bands. We're going to have the veterans from the Army, Air Force, Navy, Marines go head up in a music competition. It's going to be great. I brought the other resources that I have. I have funding because I got a grant last year. So I have $250,000 a year for the next 3 years. So we have free services. Let's say a veteran wants to get a job, and we do job placement, job training. We give them free personal protective equipment, PPE, hard hats, safety glasses, safety gloves, and all that. And then also for their families, we help them out as well. I'm not seeking money, but I am bringing financial resources for everybody and the veterans. I brought the paperwork. I would like to leave it with you and get whoever's information I need to work with on this, please.
Thank you, sir.
Thank you.
Okay, next for public comment, we have a Jack Wong.
Hi, my name is Jack Wong, and this is my second time here. I was here last time when I saw everybody here on the video. And one of my questions is, why weren't you guys here? Okay, I don't know why, but you guys have your own reason why you weren't here. We were all here. We were all there when we got evacuated from the fire. Okay, I didn't see anybody. It was a very terrible situation. And I wasn't very happy. And I wasn't very happy about everybody spent half an hour kumbaya saying how great a job you guys were doing to each other. And no one was here. Okay, I gave a 3-minute speech with my grievances and a paper. No one ever asked me what happened. No one ever came in contact with me and say, what happened? What's your grievance? And I just want to make sure that at this moment, I live in the CTRS. There's a lot of issues and problems there. But I don't think any one of you are either concerned or understand what's going on. So you guys got to spend a lot more time to come see how everybody live in the CTRS, what's going on, and how many people are abused and how many people should not be there, and how the HARP people are mistreating all the vets. There's a lot of problem. So get your butt out and get over here and take a look. Okay, you guys supposed to be vets. I'm a vet, and you guys make all kinds of mistakes on a bulletin board, putting a woman who is a wife of a Navy, and you put up there as a U.S. female Navy veteran, a Navy SEAL. You guys know that she wasn't that, and you made a correction after someone made a point of that. Okay, you had a problem here with Red Cross. I had a problem with Red Cross. Okay, no one's ever asked me any problems. Okay, I can go on and on and on with all the problems that you guys should just get off your butt and go to the West Hollywood Medical Center, CTRS, address the staff that handles us, address the HARP. Who's watching them? Who's watching them? I made my 3-page letter follow what they told me, hand it to patient advocates. Well, it just chased me out the door. Go to the police. We went to the police, Mashawn and I. Get out of here. I got no answer. So I wrote over there, accountability. Okay, I used my 3 minutes, and this is it.
Thank you. Next up is Lee Welliver. Okay, thank you. Marshawn Moore.
Hello. It's my first time here, so I don't know if I'm making the right comments or anything. So don't shoot me if I'm wrong. So, um, all I know is this board here, you guys handle veteran affairs. A lot of the county information does not get disseminated down to the veterans. Like the young man or the gentleman who was caught talking earlier on the screen, he mentioned something about a program like CTRS up there in Northern California. Apparently, that's a program that they're following, mirroring. But apparently, when you get to CTRS, I noticed there's no policy really implemented in place. People not taking showers. I mean, it's a health concern, but things are like, well, we don't know what to do. Like, we don't want to do. If y'all are the county and we know about this program, maybe they should implement, maybe the county health inspector, making them expecting. 'Cause there's a lot of things going on there. And again, Pursuto, the comment that gentleman made is a mirrored program. That's what CCR should be mirroring. So if they had some success up there, I'm pretty sure we shouldn't be having some of the issues. But my main thing is any county programs that you guys have, you guys should make sure it gets down to programs like CTRS or programs like the domiciliary, even events. A lot of things we don't know. Like I didn't know you can about a few programs. The gentleman that has my district mentioned something about a compost thing and they want to start from the ground up. And after talking to him, it's an excellent program compared to what VA's offering. At least they're paying enough attention to realize, okay, we're gonna have a garden. We need to start from some point here. But I had to hear about that here. If I didn't come here, I would never heard about it. You got a lot of programs that you guys are spending money on, but you're not taking the time to make sure it gets to the veterans. This is counteractive to what you're doing. If we're gonna be in a position to do something, then let's act like adults and like we all graduated high school. This is simple communication. And I'm saying this not to demean you. I'm saying this you're getting paid to do this, or you chose to do this in order to help. So to sit here and ignore someone communicating to you, letting you know, because you are the board that helps veterans in Los Angeles County. So we need to step up our game and let make sure these people know our programs, because we're just wasting money if they don't know the programs. Then the money's going to get cut, because guess what? People cannot disseminate, get their communication correct to make sure the veterans gets the programs that are being funded for them.
Thank you. Next up will be Crystal Rains.
I've been making some good trouble bringing veterans from the West VA campus to meet you. Last summer, I brought a friend who had graduated from the culinary arts program. I'm going to tell you that he works at UCLA and he's housed off campus now. We brought him down here so that you could learn. I'd been getting health care at the VA since 2009. It wasn't until after I got my um, peer support specialist training and certification that I ever even knew you guys existed. I'd never heard anything about you in all my time at the VA. And we all know I haven't figured out how to offer a solution for communication, but it always comes down to communication. Currently, while I live in the West San Fernando Valley, I really appreciate John. He knows me by name. I have his number in my phone these days. I try not to overuse it. I want to thank him for creating that peer resource center. And right now I'm pushing as a volunteer to make a women's support group happen there, perhaps on a Tuesday afternoon, early evening. It's I'm working with one of the peer resources that's paid there. Her name's Stacy, and she's the paid one that's talking about in the meetings. I'm told that they're having some good response back, but we'll see how things happen. We're going to offer it for 3 months. That's the other thing I've noticed is that things don't seem to have consistency. So if we say we're going to do it for 3 months and then reevaluate it, was a conversation John and I had. And if it's useful, one thing a lot of people don't realize that if we get 2 or 3 women veterans, we should be really happy because we don't always have time, and we got to appreciate. I know that sometimes we've had things down here and we've had really good showings. I will tell you, the Battle Boutique, the outfit I'm wearing today was from that. So I was really happy to wear that today. Look professional because of that. Thank you, Rocio, because I know you were part of making that happen. Um, but I'm really want to know. Oh, that's the other part about communication. So currently I volunteer at an organization called LA CAN. That's the LA Community Action Network. It's on 6th. They do outreach for the homeless community on Skid Row. And I've been talking to them down there. I learned something from Calvet that I know that women don't always identify as veterans. What Calvet has determined is that while they won't identify as veterans, they will identify as serving in the military. Now, I like to tell people this is what a veteran looks like, purple hair and all. Um, but, and I've been waiting for the person who tells me I'm not. I haven't ever had that, never had somebody give me a hard time about my parking place or any of that. I've been waiting, I've been prepared. But in the meantime, I'm downtown on Skid Row talking to these organizations because we need to find our women veterans that are on the street. I've been talking to them about
Thank you.
asking that way. Thank you for your
Thank you so
time.
much. Next up, Kyle Coleman.
Good afternoon, Commissioners. I'm Kyle Orleman, Orlemann. It's a little hard to read my writing sometime. Thank you for the opportunity, and I know you each got a copy of the voucher allocation map, and I'm going to make reference to that right now. One of the things that I have a concern about is that we all know that there's a limited number of vouchers available, and that we are coming up to the limit where we will not have more vouchers available unless people make changes that nobody appears to be making at this point. So my concern is with the parcel release map as it is right now, two of the parcels that are scheduled for release on the map are labeled 408 and 409. And if you look at this map, they are quite a bit isolated from the remainder of the North Village Veterans community that has been constructed and is largely open at this point, or will have more buildings opening this year. So basically, my concern is, as the daughter of an architect and somebody with over 30 years of space planning experience, putting these two buildings down here to have the voucher funding is not the best use of those vouchers. I strongly suggest, and I ask you to talk to your supervisors, to switch the funding from 408 and 409 up to 400, 258, and 206. The reason for that is that that would make the North Village contiguous. And I'm leaving 257 out because I know that's where the women veterans are right now. So that should be the last one that should be moved out of and reconstructed. So again, my suggestion is to take the vouchers that are dedicated to 408 and 409, move them up to 400, 258, and 206. And the second thing that I wanted to address is the comments that were made earlier today about the Presidio. I agree that the VA has done a magnificent job of taking care of the medical needs of veterans. My husband, who is severely disabled, has been getting his care there since 2003. They've saved his life more times than I can count. So I'm not saying anything against the VA's ability to take care of the medical issues, but they're not space planners, they're not land developers, they're not builders, they're not contractors in this sense. I think the idea of looking at another agency such as the National Park Service to develop the same kind of concept that they did at the Presidio is something that is very, very worth exploring. And I think before we get too much further down the line on this, especially with 408 and 409 situation, I really think we should be looking at bringing in an outside agency for a public-private partnership. And the other part of it is, rather than just having the veterans who live on the campus all be people who are coming in from homelessness and may have substance abuse problems, there also needs to be a general community for veteran families, veteran students, veterans who are aging and no longer have ability to live in the community by themselves and should be nearer to their medical facility. Make some accommodation for those of us who are seniors who need to be on that campus
you.
and the support services. Thank you.
Thank you. That's everyone we have signed up for public comment. Is there anyone else in the public that would like to speak? Anyone else?
Sorry, we have Daniel Bothi.
We have a hand up.
Yeah, please.
Yep. Hello. Can you guys hear me online?
Yes.
Hey guys. Hey commissioners. Hey fellow veterans. My name's Dan Bothan, and just kind of my position here that I'm going to share with you today represent my own opinions. None of them are related to my employment with the federal government. Personally, I was born and raised in Echo Park, lived in Glendale, Burbank, joined the military commission through the Air Force Academy. I was lucky to be stationed my last duty assignment here in my hometown at LA Air Force Base as a program manager. So after active duty service for 7 years, I had the chance to serve even on the South Robertson Neighborhood Council, and I'm really committed to making the communities I live in a better place. My personal story relates to my knowledge and understanding of the VA West LA property, federal funding, and how it can directly impact the lives of not just current veterans, but for generations of veterans to come. Hopefully, we don't fight too many more wars or anything like that, but let's take care of each other. My grandfather lived at the Calvet West LA long-term healthcare facility. He passed away during COVID, unfortunately. I regularly drove there around the dilapidated, underutilized VA campus during my monthly visits. In hindsight, I probably should have visited more, as all grandchildren probably should. But the purpose of my comment here today is not trying to point fingers at the VA's decades-long neglect for the Pacific branch. Obviously, that's not productive. Instead, I want to provide some solutions, as I've heard here from a couple other fellow veterans, and I think the doctor broke the ice this session with how we can accomplish that mission today. I believe that long-term winning strategy for the VA West LA is a financially self-sustaining community for all, not just homeless veterans. We should aim to provide permanent housing opportunities for veterans with service-connected disabilities, as the land was originally intended. We should also focus on short-term housing opportunities for recently discharged veterans to prop them up for success for life after service. We can do both. You've heard kind of a minor business case analysis earlier. Lastly, as a nice lady just said, we need to let the VA beat the VA. They're a healthcare agency. They're not a visionary land developer. So let's not look the other way as the VA fights these different projects in courts. Let's offload the planning, development, execution, sustainment of this veteran serving community away from the VA. One of those options, obviously, the National Park Service, because we could actually deliver something even better than the Presidio of San Francisco is what I'd like to be, better than Northern California. Anyway, the precedent's there, purpose is there, the land is there. So let's execute now. Seriously, we're all veterans here. Let's help each other out. The VA is only looking out for itself, and we all know how programming budgets go. So let's get it done now. And I recommend creating that Pacific Branch National Veterans Park. And I'm on board with that, and I hope you all are too. Thank you.
Nope, thank you. We have one more.
We have two more.
Two more?
Harry's.
Harris?
Good afternoon, Morgan Harris. Thank you for the opportunity today. As a Navy veteran familiar with VA operations, policies, procedures, and priorities, as well as a wealth of knowledge regarding the rich history of the National Homes for Disabled Volunteer Soldiers, and a former patient who is a vested community member of the 8th oldest national home at Danville, Illinois, which opened in 1988. And is currently known as the VA Ileana Healthcare System. I feel uniquely qualified to express what a unique opportunity the LA County Veterans Commission has to impact the overall health and well-being of today's veterans. The National Veterans Homes were built on the principle of what today would be viewed as whole health and community driven. The homes were flourishing ecosystems on the edge of their local communities, within proximity to the hospital, but outside of those clinical walls, in an effort to offer a sense of belonging and normalcy as a reward for bravery and in recognition of what was deserved for these soldiers. Unfortunately, as others have pointed out in their comments and remarks, the VA will always have a conflict in prioritization when it comes to housing veterans and in immediate provision of clinical care, as that is their focus. Through no fault of its own, the VA is not able to facilitate, oversee, or develop veterans' homes without private and public partnerships. I would implore you to revisit the structure and those partnerships that have proved so successful in the past by allowing the creation and the takeover of the Pacific Branch development through those private and public partnerships, so that you can see success in creating this very important housing, but also whole health opportunity for LA's local veterans. Thank you so much for your time.
Thank you.
One more. Anne.
Anne?
Thank you. Hello, my name is Ann Marshall, and I am a former U.S. Army artillery officer and previously also served for Cohen Veterans Network, a nonprofit providing mental health care for veterans and their family members, including a clinic we have in Torrance. Today, I work as a wildland firefighter on an interagency crew serving all 50 states, including California. And I have tried to follow this ongoing situation at VA West Los Angeles for several years with an objective lens, as open-minded. This property was originally meant to be a home for soldiers in need, and that need, as we know, has never gone away. As someone who returned from deployments mostly intact myself, I know firsthand that a nurturing, holistic space could have made all the difference for fellow soldiers that I loved, those who struggled immensely under the weight of their physical and mental wounds. Hospitals and outpatient care are just sometimes not enough. Creating a sustainable community-centered space is the least we can do to honor and care for those who have given everything but their lives for this country. The VA's appeal of Judge Carter's order to build housing for veterans tells all of this has never been a priority for the agency. In LA's West Side diverse community, land use matters are complex, especially in light of the fire devastation. That is true, and the time is always right to do the right thing. I believe we should look to another federal agency to move this project forward. Let VA West LA's troubled history be wiped clean, elevating the historic Pacific Branch property to the status of a national park, separating healthcare functions to the South Campus and veteran community serving needs to the North is a reasonable way to create that correct alignment of agency priorities and provide for real human needs. Every chance we have to get closer to our humanity, let's do it. The VA does healthcare and not housing, creating that sense of historic purpose for public lands. That National Park Service could be tasked with preserving and implementing the Pacific Branch as a community for future generations and generations of veterans. And I do truly believe that they can succeed and thrive in this. I cannot think of a better way to create a national emphasis that this land offers than for veterans land for all time. I share this belief with veterans you've already heard from in the past, and I stand ready to support the Pacific Branch National Veterans Park in any way that I can. Thank you guys so much for your time.
Thank you. Anyone else online?
No.
Nope, that's it. Anyone else out in the public? Okay, thank you for your public comments. Moving on to agenda item 7. That is the department report from the director.
Good afternoon. I think we're pulling up some slides. While we're pulling up slides, I just want to flag for the commission that LA County is in its first year of doing departmental budget hearings, public budget hearings. Zuleda and I gave MVA's public budget hearing presentation this last Tuesday, so 8 days ago. We're still getting through all the other departments' budget hearings, but yeah, that's a new kind of space for county departments. And I think it was a great opportunity to put the needs of the department and the population on the public and the board's radar. So hopefully we represented our veteran community appropriately on there. Next slide, please. So we're looking at year one. This is what I spent my time putting together during the New Year holiday, just time to think and strategize for this year. And so looking at 2024, we had considerable growth to the department. We established 2 additional divisions, Justice Involved Division and the Homeless Services Division. The department also acquired VPAN and the Veteran Suicide Review Team. We partnered with the Warrior Heritage Foundation, entering into a contract in October of last year. And then we kicked off our inaugural annual Women Veterans Summit last year, which we're planning on the next one for this year. So that's an ongoing thing that we are going to continue to host to elevate the individual needs that women veterans have as far as getting care in their service in the military, to really use it as an advocacy platform to push those needs to our state, federal, and other partners. So looking at 2025, we plan on working intentionally to create workflows and procedures. We really just, we're getting a lot of feedback from the community and opportunities to partner. Obviously, tackling things like homelessness is really demanding. So we were kind of just doing the work and not creating the workflows. So this year, we're going to intentionally spend the time to create good workflows and procedures to make sure that we're working efficiently as we're tackling the priorities of the department and the community. Another priority is strengthen our department fiscally. We're not going to be looking for any programmatic growth that over the next year that doesn't come with dedicated funding. That's really hard for me and my team because we pride ourselves as being get to yes people as public servants. So we hear a lot of great ideas from the community. It's just we don't have the bandwidth to continue to take on additional programs without dedicated funding sources. So we're not slowing down. We're looking at federal and state opportunities to draw down additional fundings to take care of our community. And then look into ways to improve our professional growth for our employees now that we have really top-notch employees in the department. We got to make sure that we retain them as they continue to grow within the department. So those are our key priorities in 2025. Next slide, please. So Warrior Heritage Foundation, I know they came and presented, gave public comment and then presented to the commission. This really kind of from an MVA perspective, we have a lot of administrative burden around running events. We don't have a position in the department that is an event planner. And so that was creating a lot of stress and administrative burden on the team. So Warrior Heritage Foundation, that's a part of the role that they're coming in and playing. There's other ways that they're taking administrative burden off the department. And allowing us to bring more attention behind our administrative processes, like I mentioned last slide, being intentional about building out workflows. And another part of Warrior Heritage Foundation is launching programming specific to military transition, veteran well-being, and historic preservation. Traditionally, things that's difficult to get funded. As we're tackling big problems like homelessness, our justice impacted veterans that experience a very fragmented system. One thing that we identified is we're calling courts veteran treatment courts in LA County that aren't truly veteran treatment courts. They're collaborative courts, which isn't a bad thing. But if you look at why veteran treatment courts are effective, it's because they harness the military culture, the accountability to each other, the esprit de corps that we bring as veterans. And when you mix us with other populations and you don't capitalize on that cultural aspect, it really isn't, really delivering the results that having a true dedicated veteran treatment courts will have. So, there's a lot to fund there. There's a lot to advocate there. And so, but, when we talk to the veteran community, what are we doing about military transition? It's still broken. It's a federal responsibility, but we have veterans transitioning not to VA hospitals when they get out, not into the federal structure that we had when we were in the military, but into communities. And so local government plays a huge role in the military transition. And so we're, tackling those needs that we hear and wants from the veteran community here in LA County through the partnership with Warrior Heritage Foundation. I've said this every year since I've been appointed, but next year is going to be even better. 2025 is going to be even better, and absolutely, it's time to get after it. Next slide. So these are priorities of the department by quarter end, calendar year quarter end. So our first calendar year quarter end is April 1. So we've had some turnover in the Veteran Peer Access Network program. Battleship Iowa is no longer the community-based provider for Supervisorial District 2 and 4. National Veteran Foundation is a provider for Supervisorial District 2. VST, or Veterans Serve Together, is the provider for Supervisorial District 4. We're currently onboarding them, making sure that we support them and that they know their success is our success. And there's a lot of anxiety standing up teams, especially when they're innovative and they're not like bringing on like a SSVF team, which has a lot of programmatic guidelines and stuff that you could fall back on. Veteran Peer Access Network is really unique, what we built here. So really making sure that they have the support they need to be successful. We're also working on putting together a couple of annual reports for calendar year 2022 and 2023 with VPAN. We do have one from 2021, but we're working on those. And once we have those complete, we do plan on placing those on our website so that you and the public can reference those annual reports and really see the impact that VPAN has had on our community. One thing to note is our work with the Veteran Suicide Review Team is we've noticed in between 2015 and 2019, the rate of suicide was over 110 suicides per year from the veteran community. Since VPANs came on board in 2020, we've seen a reduction in over 20% of veteran suicides. We can't really prove causality with our current data collection, but we are working by onboarding Dr. Ali Taib, who's a PhD and Navy veteran, to really dig in and see how do we do a better job with our data to really show that VPAN was a main piece of reducing that suicide within our county and the veteran community. Create a legislative outreach and engagement plan. As you know, our office does a lot of work with local elected officials, state and federal elected officials. So really creating a well thought out and effective outreach and engagement plan to make sure that we're increasing our communication. A lot of our efforts so far has been reaching out to elected field offices, letting them know about VPAN, letting them know about our veteran service officers that are accredited and how we can help their constituents. But also on some legislative things, whether it's federal back in DC or Sacramento up north. We are talking to legislative directors about the needs that we're seeing down here in LA County as well. One piece that's a little bit more internal, but it's really in any place of employment, performance evaluations that you do with your staff are really critical tools to professional development and really a great way to highlight the great work that staff do. So we're really working on getting a stronger handle on PE tracking and supervising staff being trained up to maximize those performance evaluations. To this date, we've had one IT employee running around all over LA County trying to make sure that all of our 65 staff have connectivity to IT. We were funded an IT supervisor, and so we're working to recruit that IT supervisor to bring in a little help to tackle the IT issues. And then we're also going to finalize our first inaugural MVA 23-24 annual report. So we're switching from calendar year annual reports to the actual county fiscal year reports to make sure that we're aligned with county efforts and the overall county strategic plan. But in our first annual report as a department, we're really going to not just highlight VPAN and our work of our VSOs, but also our efforts around suicide prevention, our efforts over the year around women veterans, our efforts around our Justice Involved Division, really highlight all the areas that the department has been prioritizing based on community and Board of Supervisor priorities. Next slide, please. So this calendar year quarter end ends July 1. So looking to have the Homeless Services Division surge funded. So I presented to this commission a few months back about the MVA's plan to really dig in and tackle veteran homelessness with the passing of Measure A. So we have the plan. We're just doing everything we can to get that program funded by the July 1 so we can kick off the county calendar year, not the calendar year, but the county fiscal year with that programming. Also complete workflow mapping for referrals. So we've added an MVA intake team to be more responsive to incoming intakes and inquiries for services via email. Also, the intake team covers our AWS support line, so the 18774 LA Vets. It's no longer what it used to be. We now use Amazon Workstation, and so it's like an actual call center. So we've been really working on responsiveness. There is data that we release in our commission slides that gets posted on our website. So if you're interested in how we're doing, as far as answering the phone and the amount of folks that we're not able to reach, that we're calling back, all that information and data is available on the website related to that. We're currently in the middle of doing our first department strategic plan. So we should have that. We will have that. It's a brand audit and fix. There's been a lot of inconsistent information throughout our marketing and communication. We're aware of that. And so we've recently finished our brand asset. We've shared that with VPAN. We're working to make sure that all the staff understand how the brand is properly used and can be used in marketing materials. Next phase is really doing a brand audit, making sure that the website, everything's functional and set with our brand and really tighten that up. And we have a goal of getting all that done by July 1. Establishing the Veteran Suicide Review Team implementation plan. So we have the team that is currently reviewing all the suicide deaths that we're able to when we get next of kin permission to share their loved ones that died by suicides information. And we're noticing trends. I think we're coming up on our 10th review coming up, so we're starting to see some of the trends that are apparent in veterans that are dying by suicide, like what's leading up to them dying by suicide. And so once we continue to bring in this data, the next step is really, what do we do with the data? How do we start using this data to really get out in front of suicide here in LA County? And so that's what we mean by establishing an implementation plan or team, really bringing in folks that are operating programs on the ground to take that data and really kind of create strategy behind it that we use in our programmatic outreach efforts. So teams like the VMET team at the VA and at the Sheriff's Department that respond to crisis, that would be an example of who we'd want on the implementation team. Leadership and VPAN we'd want on the team. Certain VA partners we would want on the team. So folks that run programming that outreach and engage with veterans is who we'll be looking to recruit on that team. Then lastly, create a VSO outreach and engagement plan. We know we have several VSO posts across the county. We have not had a coherent outreach strategy or plan to date, but we are planning to have that plan up and going by July 1. Next slide. So this would be October 1. So to have the JIV division funded. Our supplemental budget is passed in October, and so that's why we kind of align that. There's a lot of opportunities to fund the JIV division through funding pots, primarily AB 109 that gets decided during the supplemental budget phase. Create a streamlined IT workflow. So once we onboard the IT supervisor, really create a streamlined approach to get IT support throughout the department. Next is really create a military outreach and engagement plan. I've heard frequently from the community and some members on the commission that reminded me that we're not just the Department of Veteran Affairs, we're the Department of Military and Veteran Affairs. And so that is what that plan will do is really create a plan for us to implement as far as like regular communication with military, certain things that happen at the state that when the governor brings all the military together, that we're at meetings like that. So as we kind of build that out, we will circulate that to get input from the community and the commission so that we're not missing anything when we're putting that plan together. And then next, the MVA 24-25 annual report being finalized. And then also in this is an RFI for a housing parking structure. So we've had conversations with Department of Economic Opportunity about getting a request for information or request for proposal out there so that developers can have an opportunity to make proposals to the department and the county to build a parking structure and housing in this parking space next door. If you were able to catch the budget hearing that we gave last week, Supervisor Solis was very clear to the CEO during that meeting that she wants us to dust off that old plan that we put together in 2019 and start getting to work on that. And so that hopefully I have a very aggressive goal to get that RFI out by October 1. Next slide, please. And then Q4, in the middle of 2026, a lot of the prevention or maybe all the prevention dollars that traditionally went to counties through MHSA, which is now BHSA, is being taken back by the state to be implemented at the state level. And so we need to identify an ongoing funding stream for VPAN. That's something that we're working on today, and we're having conversations with the state to help identify a funding stream for VPAN ongoing. And really, it's our intent to also advocate for other counties to have the ability to opt in to similar programming across the state. We've had several counties reach out and kind of ask us about how we created VPAN, how it's funded, is it scalable, things like that. So there is significant interest, mostly from counties here in Southern California. And really where that would be beneficial, from my opinion, the first 4.5 years of the Veteran Prayer Access Network, as we know, veteran and reservist and National Guard, we're a very transient community. So some of us drill in LA County but live in Riverside. Some of us drill in Riverside but live in LA County. And so having a program that's county specific and not doesn't have capabilities statewide, we run into, and our teams run into, a lot of issues where somebody might have a family member in LA County, or like I said earlier, drill in LA County, where there's like handover with the different counties. We coordinate at the VSO level, but we don't have enough VSOs to keep up with the demand signal as it is. So we don't have time to really do a lot of the navigation and making sure that folks don't fall through the gaps that VPAN is able to do. And so that's where it's not that we're not coordinating at the County Veteran Service Office level. We just don't have the resources in other counties like we do here in LA County to meet that need. And so that's really going to be a huge priority that we continue to push moving forward throughout the whole entire year. And then lastly, I talked about this with the Warrior Heritage Foundation, identifying funding for the launch of the transition program, the well-being program, and a historic preservation program in partnership with the foundation. One thing we recently learned is that there is potential grants to fund field trips from middle school, elementary, high schools here to Bob Hope Patriotic Hall to share our rich military history. There's nothing I would want more than to get that funding and just see the hall flooded with kids learning about, military history. We had one opportunity to host a middle school class who was learning about the Vietnam War. We were able to bring in some folks that are knowledgeable about the Vietnam War and really kind of give them a lecture and then show them around the building. And it was very gratifying to see that and to see those kids enjoying this beautiful building that has been supporting our community over the last close to 100 years. So really want to do a lot more of that. And Warrior Heritage Foundation is going to be our partner in making that happen. Next slide. We can skip over this slide. This is more kind of roles and lanes, as we've added a few consultants and some new staff. That is a slide I've used to communicate to my staff. Like, when do you loop in, when you're talking suicide prevention, when do you loop in Dr. Tayeb, for instance? When you're talking legislative affairs, that's when you loop in Robert Alvarez, things like that. So making sure that we're communicating the different roles and stuff like that. And that concludes my report. I'm happy to answer any questions the commission or take any feedback from the commission at this time.
Commissioner Palmero.
I was just waiting to be acknowledged by the chair. So I know that we've talked a lot about the work towards helping to make sure that veteran women are seen and that our service is acknowledged. And I'm so thankful. I know we're working very, very closely with Supervisor Solis, who created that motion. But I also want to know that as we are anticipating turning this into a living museum, that we're going to have a little bit more representation from the veteran women here, because we don't have a lot of pictures. We don't have a lot of that history that's talked about. So I just needed to make sure the squeaky wheel gets the oil. So I'm squeaking right now. Like, don't forget our sisters, please.
Duly noted. Yeah. And one thing that the department has had is conversation with Warrior Heritage Foundation about the modernization. As much as I love history, We've done a lot of work post 9/11, our generation, in the war on terror. And so there needs to be some modernization around that, some modernization around uplifting women veterans and other issues like that. So yeah, I think we started to talk about it, and, we need to continue to hear from the commission and the community about what everybody wants to see in the hall. So I appreciate that comment very much.
Thank you.
Commissioner Jackson Kelly.
Yes, thank you. Um, I listened to I listened to the budget hearing, and I wasn't sure, was there something that Supervisor Mitchell was asking?
Yeah, yeah. Recalling Supervisor Mitchell's priorities, she's been very focused on justice-involved veterans, and she did bring that up during the budget hearing. All my conversations with her staff are really grounded in what are we doing for our justice-involved vets. So that's her priority. Her priority has always been taking the services to the veterans. And so we brought that first claims clinic to SD2. We're bringing an opportunity to provide dental care to SD2. We're looking at potentially April to conduct that clinic. And then issues around equity and equality. Those are really Supervisor Mitchell's stated priorities with our department.
Thank you. The other thing is, with VPAN coming under the Military and Veterans Affairs, is that incorporated into your budget, or will you be receiving additional funding for VPAN?
Yeah, so the way it happened starting October 1 is the funding for VPAN is transferred over from the Department of Mental Health over to the Department of Military and Veteran Affairs, which is about 5.7 million a year. So now with that funding ending in middle of 2026, we're looking to make sure that we identify funding at the state level moving forward so we don't lose VPAN as a program. And really why it's important, some people say, well, you should go to the VA for that funding. And the issue with that is what we've done with VPAN is it's a no wrong door. We fill the gaps. VA can't serve 15% of the veterans here in LA County because they're not eligible. And so it's important that we have for that program specifically that funding comes from the state so we can really serve anybody regardless of discharge status, as well as other populations like family members and caregivers of veterans, which I've heard a lot of feedback both from the community at these meetings and from the commission as well. So that's just a little, I know you didn't ask for that, but I just wanted to give you, that's why, we're strategically talking to the state about that funding and not going to the VA.
Okay. And my final comment is, I was approached regarding the Black History program that was supposed to be here. And I haven't heard anything since. And I'm just wondering, is there any plan for Black History recognition?
That's a great question. And yeah, we really on the display, we got it set up a lot later than we wanted to. We're in the middle of transitioning exhibits and events to Warrior Heritage Foundation. And that's some of the pain points that we've identified early on. So it's not because the department didn't want to prioritize it. It's just working through the kinks with a new foundation to actualize that. So I'm not tracking an event that we're actually doing at the hall, but I will ask my team and get back to you on that.
Thank you.
Commissioner Fulmer.
Yes, thank you for the report, Director. Quick question about VPAN. I wanted to know if, since we're approaching the deadline of mid-2026, what is the likelihood of county in discussion with community-based organizations as a direct partner or more skin in the game for their influence on the VPAN program? Because currently, my hat's off to the current community-based organizations, JVS, Goodwill, even the National Veterans Foundation and VST, because typically these programs are reserved for Southern California or areas of Los Angeles County. And we're asking these community-based organizations to refine their focus to these districts, the 5 districts that we have. What is the opportunity for these community-based organizations to lean more into the program to fund it for overarching impact across the county?
So are you, sorry, I'm missing the question. Are you asking like the CBOs to lean into fundraise to?
Yeah, to be able to be an active part of this, because it seems like if I'm incorrect, VPN is a two-part partnership, correct? It's ran by the community-based organizations in partnership with county?
So it's county funding that goes to the CBOs. So that's county ran or county led, but it's really the CBO teams that are out there doing the work. So it is a partnership. We like the flexibility that the community-based organizations have. Government tends to be a little less flexible. So, with our county VSOs, we wanted, and same when it was over at DMH with our county funded clinicians and staff, we wanted the community-based arm of it. Community generally gets out in there and outreaches a little bit differently than we think of outreach as a government as well. And so that's why we created that mixed team. But that's an interesting concept about having a conversation with the actual CBOs about potentially working together to help fundraise to sustain the program. So appreciate that.
Commissioner McFadden?
This may be a big one or a small one, or you may not have an answer for it, but I wanted to know how, if at all, does the current political climate impact any of the efforts that we do here or any work that we're working towards going forward?
Yeah, that's a great question. And we've been talking a lot about it. And it is big because it's ever changing every day. So we're currently putting together an inquiry to the VA on the staffing impact as a result of the 1,000 staff that were laid off, that were in probation period. We have no idea to date how many of those staff were based here in LA County. So we're putting in an inquiry and then also asking about any kind of any potential impact that might have from their perspective on programming. So that's something we're putting together. I know our technical assistants that helped put together the VA1 team that's led to all the great results that we've talked about has been interrupted several times. And so there's been a lot of advocacy to date to make sure that does not continue to get interrupted because it really has led to tearing down a lot of silos and barriers that typically exist in the service provider world. And really the main reason why I see an opening to really end veteran homelessness. So that was a concern of the department. And then there is some delays in the legal services grant that we were awarded last year and awarding it again this year. The VA did put out that 44 community grant programs that they have are not going to be impacted. So, we're not sure that, what is going on, but we're hoping that it continues to stay funded so we can provide legal services to our homeless veterans. But the rollout is being delayed. So, and we don't know what that means. Those are the main issues that we see. There's also some other moves that have been made that don't have such a direct impact, but are very important to our priorities here in LA County. And that's the elimination of several positions. The Women's Health Program Leadership Program Director, I think she is no longer there. And then the Minority Veteran Leadership. So those are two positions that impact our priorities here in LA County that don't necessarily have as an immediate of an impact, but have an impact as far as helping our women veterans be seen and making sure that the programming is fitting their needs as well as our minority veterans. So that's kind of what I see as a department and what we've talked about as being the major impact so far with the current administration.
Commissioner Brooks?
The question, did they give you money? Did they give you money for the veteran service organizations helping?
There is no money at this point. The budget's still being deliberated. So all the departments are presenting our budgets. I think the last is next week. After that, 2 weeks from next week, the board and CEO are going to get together and make decisions on budgets. That'll be presented in March, and I'll have a better picture for you at that time. But we haven't been given the money yet.
Okay.
Yeah.
Commissioner Noyola?
Thank you for your presentation. One of the things that I was not able to pick up very directly is, and particularly based on some of the public comments that we've heard today and also previously some presentations, dealing with the West VA campus is what plans do you have moving forward in ensuring that this area becomes a focus of the department to ensure that there is adequate representation from the county to also see what the impact is of that area and housing and supportive services that were planned for that area that clearly are impacting our veterans in this county.
So when you say that area, are you talking about West LA campus in particular? Yeah, so I've served on the Veteran Community Oversight and Engagement Board, and I've been supported in doing that by county leadership close to the last 6 years. That really gives us a front row seat into a lot of the discussions, bringing up concerns such as the town center and things like that. So that's probably the first way that we've been able to make sure that we have appropriate representation. We work very closely with the VA on and the principal developer on the Community Resource Center, which was started as the Peer Resource Center. That really is going to be important to make sure that VPAN and VSOs from MVA are there, really kind of seeing what the demand signal is and seeing how veterans are being treated on the campus. What needs outside of the VA are needed so that county can make sure that we step in and provide those. One thing that's top of mind for me is the family members that are moving in with the veterans on the campus. We know that the VA does not have authority to provide healthcare and other services to those family members. And so that is really kind of some of the obvious needs that we need to be tracking, and we will be tracking through having a presence ongoing in the campus and on the Peer Resource Center. Some of the magic about being located in the Community Resource Center or Peer Resource Center is that's really where the organic veteran to veteran conversations take place. When you're in a medical setting, you're going to, you have medical professionals, with the cloak of professionalism talking to veterans a certain way, and veterans don't always feel comfortable, so they're not quite themselves. But in the Peer Resource Center, just like if you go to any VSO posts, those are very organic veteran to veteran conversations. And that's really where you're going to see what the needs are and where the unmet needs are. And so we are strategic about making sure we continue to staff that particular program. So we're tracking those needs. Good question.
Any other comments from the commissioners? Any questions?
I have a final question.
Commissioner Jackson Kelly?
I noticed that practically every other entity has paraphernalias identifying them. Who do we speak with that the commissioners can get a jacket, a sweater, hanky, or something that identify that we are commissioners?
Yeah, well, you're talking to the gentleman who runs the department, so if I can't make it happen. I mean, I just, you guys know me, I'm accountable and everything stops with me. So yeah, so I think we're still, I got to get an update on the logo that you guys put together. That was
Still fighting that battle?
that was hours of my life I'll never get back. So I want to make sure that we make that happen. So we need to get an update on that. And once we have an update on that, it would probably be a conversation with the foundation about finding a way to support some apparel for the commission through the foundation. Sorry, I didn't mean to bring up any
Do we ever get the,
past traumas or,
do we ever get the actual approval?
yeah, sorry. Sorry.
Do we ever
I'll let the
actually
past be
get
the past.
approval from the CL for the logo or whoever it was?
So there's two ways that we do business with the board. There's board letters that have to go through cluster. We belong to the social service cluster. So basically we can submit a letter. It goes out for public comment, all that kind of stuff. There are deputies in that sector, review everything, ask us questions on anything. A logo is probably not going to get any traction as far as comments or anything like that, but that's one way. And then the other way is a board motion that I think the public and the commission is familiar with, where the board will take action on their end to make things happen. So it's scheduled to go to cluster. I think really soon. So once it's through cluster, then we have the approval and then we can start working on getting those fancy jackets.
Very good way to put it.
Yeah. Yeah. So I mean, at that point, once we have the logo, then we can reach out to the chair, ask the chair to discuss with you all kind of some of the apparel that you guys might want to rep.
Thank you.
Great. Any other questions? Yeah. Commissioner Emmons?
Jim, there was a public comment from one of the individuals here about the living conditions on the campus, I believe. And I was curious, what are we doing to have accountability for the living conditions of the veterans who are living on campus right now? I've also heard unique murmurs of different veteran suicides already on campus. What does accountability look like that for those scenarios?
Yeah, I think it's really important, and the public confuses us with the federal VA a lot of the times. So there's jurisdictional issues. So the VA is a federally ran department, and so while it's a different jurisdiction, we work very closely with them, and it's important that we do work closely with them. And when we hear complaints from our fellow veterans in the county, that we relay that information to them, and really work. What I always tell the VA is your success is our success. If you guys don't succeed, we don't succeed. And so we take that mentality from the county and take that to the VA as we're giving feedback. So that's really how we work on issues like that, is sharing the information and then just being a problem solver in the room with our VA partners to better meet the needs of veterans in LA County.
Any other questions for the director? So I had two. I'm not sure if you have any updates for the wildfire situation. I know first with the shelter and the evacuation that happened here, and then also kind of what the response or what the demand has been in Altadena for resources.
Yeah, so we got a call late Friday night from the VA asking if we can turn Patriotic Hall into a temporary shelter. I never saw that coming, but the need is there, and this building is for vets. So we reached out to our emergency folks in the county. They got us on a call Saturday night with the Red Cross and planned it out. And so, this building will continue to be available for the veteran community if there's any emergencies. It was really kind of insightful for our staff here at MVA to really work with veterans who needed the shelter here in the building, because typically we have veterans come in and get services on the second, fourth, or sixth floor, things like that, or we run events. So actually getting to spend that much time with veterans, my staff really kind of enjoyed that time and shared that with me. So that is something that moving forward, as long as I'm here, this building will be open for needs like that. And then as far as the DRCs, Calvet really sprung into action very quickly. Secretary Singh flew down. We met at the Disaster Recovery Center off of Olympic and talked about, what the needs of LA County from what we were seeing. I shared about the sheltering that we did here at Patriotic Hall, kind of some of the referrals and opportunities to collect donations, things like that. And so we put together a game plan. She allocated staff to support the DRCs, and really they acted to mobilize us, both the VSOs and VPN, to come in and start providing support. We started seeing needs that could only be met by SSVF. So, we really kind of worked with Calvet to mobilize local SSVF providers, but it's a model that worked really good. And I think it makes a really good case for other counties to develop VPN and the state to fund it. Because, disasters like that, we were able to mobilize quickly. Feedback that we got from Calvet, on the ground Calvet staff, is that they've never seen a disaster recovery center stand up so quick for veterans. So it's a model that we're going to, roll forward. But yeah, it was great to have the state come down and say, what do you guys need? Part of the need was some VSO coverage. So they were able to help fund VSOs from other counties across the state to come down and provide some of that support. So that's an example of how we work together. The demand signal has been, we've served about 700 veteran households in the 3 various DRCs since they were stood up. It's starting to slow down quite a bit. We're getting maybe 1 or 2 in each of the sites a day now. So we're talking about staffing levels, and maybe we just have make sure there's 1 VSO, and maybe having VPAN be on call so that they can do other work. And if there's a need, VPAN can be available to come support that veteran or veteran household that comes in. So, but I think right now we're slated to have the center stay open until mid-March, is my understanding currently.
Great. And then my other question was, I'm not sure if the other commissioners are aware about the cultural competency training that's going on. Have you received any feedback? I've started to notice that it's rolling out to the other departments within the county.
Yeah.
So,
Yeah, so we got funding to roll out cultural competency. A lot of my advocacy internally in the county has been we are a population that has a certain cultural need, and there's certain cultural needs within our cultural need. So really kind of emphasizing that so that we have a growing level of cultural competency when it comes to military and veterans. So yeah, we have a cultural competency training that is available, and we actually offer it to all county departments as well as nonprofits. So if nonprofit providers here in LA County want to sign up, they can. Another one is really kind of police departments. So cities, city government, city offices can request the training as well. And I know we've provided some trainings at the city level as well. So.
yeah, no, it was really good to see it kind of roll out and reach departments that I typically didn't see involved in the veteran space, but they were all, and they seem very responsive to it. So I appreciate that getting out there. Great. Thank you, Director.
Yep.
Oh, see, Commissioner Palmero.
So I just wanted to piggyback on that. I know that there were a lot of different laws, rules, acts that are now being applied for benefits, right? To kind of expand on the Stafford Act, for example, trying to look at those zip codes that were affected and making sure that our veterans are being taken care of, because now it's not just SSVF or any of the other programs. Now we're able to apply for federal grants. And I was just wondering or different kind of funding. And I was just wondering if we have training to show and to be able to direct some of our VPAN staff to know more, like the ones that are dealing with the housing, the ones that are dealing with all the different programs, if they're aware or have they been trained on how to connect our veterans with some of these other funds that are being released specifically for survivors of the fires.
That I'm not 100% sure. I'd have to look into and get back to you. I do know, not related to the fires, we are working with the VPAN teams to get more focused on the board priorities. So things like homelessness, justice involvement. So those are conversations that we've had internally with VPAN leadership, that we are going to be training your staff up in housing navigation, and then also partnering with local law enforcement agencies to get referrals when a veteran is encountered by law enforcement. So nothing specific to the fire, but we are, for instance, the Homeless Services Division put together a training with LACDA around getting somebody vouchered. So we've started some of the trainings in the specialized areas and needs that we have, but the fire related specific funding, that's something I'd have to get back to you on, ask the team to get back to you.
And I just wanted to thank you for that response, that answer, but I also just wanted to just state that we can have all the funding, and we can have all the programs, and we can have everything, but if we do not have the training on how to connect our veterans with those services, then it's in vain. So I just wanted to share that as well. Thank you.
Agree.
Great, thank you. Moving on. So do we have any public comment related to the director's report? Yes, sir. You have 3 minutes.
3 minutes, that's good. Okay, I noticed in this director thing, there's a lot of programs being mentioned here. And like, what the hell is LADCA? What is it, what is the the VPN? And then, people are here that have been displaced from the fire, but you don't have a program that you don't know about. You're more worried about this. And then she asked a very general question to something that's affecting people. LA had a fire. LA looked horrible, from its governor to its mayor. And then she asks you something. The president of the United States showed how incompetent LA is. We're going to be something of LA, and we're here for veterans, and we have something that's really on the forefront because the Olympics is coming. We should have that answer, because if not, then it goes back to her last comment about communication. My original comment about communication. We're doing all this stuff. It's a waste of effing time if we're not going to actually make sure it happens. Communication from this board starts with you. And if they're communicating and the public's communicating, what are you doing? You may want to get your priorities in order, because they're not. You're not worried about the fire. You should be. People are still displaced from the fire. Health concerns about the fire. At the West LA VA, people have been getting sick, getting influenza A. They're having breathing issues. They're coughing up mucus. You're not concerned about the fires? Apparently, our governor and our mayor ain't either. What is going on? The communication has happened. Change your priorities. Because right now, I'm one of the people who've been affected by all this shit in the air that's coming down. These chemicals we have to breathe. I'm at West LA VA. I've been having stuff coming out of me that's never come out of me in all my life, and I'm an addict. But it's due to this fire, these other chemicals. We need to make things a priority because it starts with you. And it's been communicated. So what are you going to do? Change your priorities based on these meetings, because there's no excuse after today for you not to answer her question, for you not to make it a priority. Switch your priority down. 2026 ain't here, so don't be concerned about that. Be concerned about the here and now. The Olympics is still coming. And guess what? Your veteran community is closer to Pacific Palisades than anyone else. Do you really want that look on this county's board, along with the failure with the state and the mayor? President already showed how incompetent we are out here. Let's step our game up. Let's step our education system up. Let's step our everything up in LA. And I'm a veteran. I served this country. So switch your priorities.
Thank you. Public comment? You have 3 minutes.
Again, my name is Daryl Crutchfield. I would like to let you know that in addition to what I told you about at first with military battle of the bands and LAGS Veteran Support Group, we also have a program called It's Cool to Be in School. And we would love to work with you in that regard. Like I said, we already have the funding. What we do also with the vocational training, we also help youth and young adults start their own business from beginning to end. And we pay for their corporate filing fees. So we could work with youth 12 to 24. We have It's Cool to Be in School with another show called The Model Student. So we can help with the regard where you were talking about going into the schools, and we can help promote it and also provide benefits and services. So we just want to let you know that's available as well.
Thank you. Any other public comment on the director's report?
I'm just here to advocate about the CTR's program where I live. I'm sitting here listening. All these programs you have is the greatest thing. Whatever you do, God bless you. But I come here representing the CTRs. There's a lot of problem with the CTRs program. I don't think any of you are aware of it. You guys really need to go there and see. There's people there that shouldn't be there. There's drugs there. There's, I guess, firearms there. There's a lot of things going on. And you guys just sit there and don't know anything about it. When are you guys going to go down and take a look? Talk to the people. Talk to the people who work there. talk to Harp. There's a lot of people I don't like. There are a lot of people I do like. There are a lot of things that shouldn't be there. You know, I'll give you an example. It's like, why are people over 80 years old there? Are they getting help? You don't have the knowledge, the staff to care for these people. They're pooping in their pants, they're pooping in their pallets, they're walking around day after day not knowing what they're doing. We don't have to care for them. I talk to them. I share my time with them. They don't belong there. Does anybody know this? An individual go to my pallet next to me. I have to help them to go in. I'm looking at them. They have to have two people help them to go in. The first night, what happens? Bang on his pallet all night. I know what happened, but I'm not going to say anything because if you say anything, you're blacklisted. You are. What happened? He fell off his walker. He can't get up. The second night, same thing. Bang, bang, bang. So what happened the third day? We have what we call a wellness check. They knock on your door, are you okay? 3 times a day. Well, they missed it 6 times. The third day found him laying there, eating his feces, just laying there. The whole pallet. So they took him out. And I have more stories like that. Right now, you can go see it. Okay? There's drugs there. There's drug dealers there. There's drunk. You can get anything you want. You know? How are you going to make this better? Talk about all the programs you have. So what? You want to make happy vets go in there? Give them all the meth and give them all the drugs. They'll be in their pallet very happy. You have a lot of problems. I'm not trying to demonize you, but I'm just very, very sad because I got healed in this program. I healed myself. Okay? They offer me so many things, but I heal myself. You guys need to go there and take a look.
Thank you. Any other public comment? Any public comment online? No public comment? Went on to agenda item number 8. Yeah, Commissioner McFadden?
I know there was was it, they had the, Warrior Heritage Foundation had their event, last couple weeks ago. And I just wanted to see if they could come back and at least give us a recap of what that event looked like. Was there any takeaways from it and how we could support any of the people that were there, for those who were unable to attend? That would be helpful.
So we're requesting a briefing from Warrior Heritage Foundation.
Yes.
Okay.
And I don't know if this is possible in response to all the feedback. I know we've had VSOs and organizations come in before. Perhaps there's a representative from CTRS to come in and talk to us about the facility, what they're doing. Okay, that would be good.
So a briefing from CTRS.
Yeah.
Commissioner Nayola?
Thank you, Chair. I'm actually pleasantly surprised about the public comments that have come in today concerning the West VA campus. As you know, we already have on the list here a update on the West LA VA housing issue that I've requested to talk about. I want to just go over a couple of things and make the request that that we invite the individuals at the VA medical facility that oversees this campus locally, be that the director of the medical center or the deputy that is over the facilities, if you will, or the operations that would be most appropriate that could answer at least some of the general questions. And specifically, I wanted to address this and make sure that we get this on the record. I would like to ensure that they're able to speak to the following. the status of the local measured approach to the development of the site. What was the last approved development versus what is actually getting developed today? And who makes the decision to stray from that approved site plan? Is it local or is it at the DC level? Second thing is there was over $300 million that was allocated by the federal government to this particular site for the development of the site. Specifically, there was amount that was allocated to the local VA facility for the purposes of relocating, if necessary, any of the current functions that are within that particular area where the housing is being built. The question that I would like the VA to answer, the VA medical facility, is what are the plans to locate any functions if there is going to be any relocation, and what was the money specifically allocated for that? And should there not be any reallocation, what happens to that money? Does that get reallocated by the local VA? Does the local VA actually request that reallocation at the federal level to, assist in other program areas? What happens if any dollars that were currently allocated are not used? Is there a timeline when those that funding expires? And if there is, what is that timeline so that we, not only as the commission, but also the county is aware of what is that doomsday, if you will, if those funds are not expended by? Next one is what are the developer commitments after they build those facilities, those housing facilities, in terms of community activities, in terms of, what are their responsibility to oversee the operations and maintenance of the housing? So if they're operating like an HOA, what are they doing? And in essence, so if we have currently residents that are living there, how do they access that HOA to address these very issues as far as living conditions, and the facilities or lack of services as well? As an example, because we are building, or they are building, a community is not just housing, but there's also wraparound services, such as what are the recreational facilities that the developer is required to build if they haven't already done so? What type of shopping amenities are there going to be available? What type of public transportation is going to be made available to those that are living in that area? Eating establishment, the like. Quite honestly, many of us, obviously having been veterans, having been stationed in Air Force bases or Army posts or whatever we call these, when you go onto that facility, onto that base, you have a housing, you have, commissary, you have all these other amenities that support a community. That's what that should look like. And today we know that there are a number of villages, if you will, that have been built to support veterans in different areas and different branches of service. Is this what this is supposed to look like, or what is the vision ultimately of that? And then specifically, as it was mentioned today about kind of the way that things are getting built out, I'm sure that there's a reason for that, but I would like the local VA to really address, is the reason why there's this kind of jumping around, is it because facilities or functions have not been moved out, and therefore that's impeding that progress? What is causing this kind of non-congruent growth in the development there? And if this is going to continue in this direction, what are the developers, or how will the developers address any of the negative impacts that will occur for those buildings that are being built away from the village? And how does that impact those residents that are going to be living outside of the core, of the village, if you will, and access whatever other amenities that may be built within those that village itself? So at a minimum, I think these are the questions that need to be addressed by whomever we can come, have addressed the commission. And I would absolutely encourage you all, my peers, to put together any other questions that you have. And I don't know if that would go to the chair or if that's going to go to the department, but so we have some, comprehensive list that allows for the VA, the local VA director, to, be able to have those answers for us. And I would absolutely request that that happen next meeting. The reason that is very important is because in the month of April, the developers have asked for, I believe, some sort of financial funding, bonding and whatnot. And we need to have those, I believe, those answers before that occurs, because if there needs to be a shift, it needs to happen now versus once the financing has already been approved, because then the next thing is construction. As I started looking into this, it's like, my gosh, the ball's moving and, we have more questions than we have answers. So I'm not sure how we get a hold of the VA director, but I would ask Director, if you could assist in trying to get that person to come to speak to us at the next meeting.
Yeah, my recommendation is to get all the questions together that the commission would like to ask the VA, and then I can include that in a request to the VA. I think that would be the best way to go.
So I can collect the questions from the other commissioners. If we can have them in, does March 7th work, or March 1st, probably March 1st work?
2 weeks.
So, yeah, if we can have questions in by March 1st, and then I'll submit over to you, Director, and then we'll schedule it. Great. Timeline for. Okay, yeah, so I don't want to forget about the moral injury survey. Is there somebody, a point of contact for that, or who's?
Yes, I had reached, oh,
Commissioner Palmero?
thank you, Chair. So I have been I was in contact with, Stephanie regarding that person who wants to come in and talk about that and talk about the questions and talk about why that survey is important. And so we have someone, I've been trying to connect him, but we haven't heard back from Stephanie, and I understand now she's on leave. So I can connect them with Carmen, or I don't know who else to connect him to.
I think we start with Carmen, right? So, yeah, so we'll Carmen, and then we'll work on scheduling it.
Fantastic. Thank you so much.
Awesome. Thank you. Okay. Okay, so that's it for future. You have something? Commissioner Emmons?
Thank you, Chair. It is my understanding that the LA County Office of Legislative Affairs it has a briefing that they could provide for us, maybe on ACA 5. It was a personal income tax exclusion for military service members retiring and surviving spouse benefit payment act. Is it possible to request a briefing from them on that?
Yeah. Sorry, what was that? ACA 5.
It's being authored by Assemblywoman Shivo.
Okay, thank you. I didn't hear
Yeah.
who he said. I didn't put it in today.
For agenda items that's it. We're good on the, okay. So moving on to the next, any public comment directly related to the, to agenda item 8, future agenda items? Any public comment for that? No public comment?
On the future agenda item, I have a question here is, how do you vet nonprofit organization coming to the West LA? Do you vet these nonprofit organizations to approve them to come there? Because I'm in a tiny home and there's a lot of nonprofit organization come there and they just put their tent up this place and give us free things, which is great. They ask you nothing. Just come here, you need sandwiches, clothes, and I found out that they're not even approved. They just come there. Okay. And then there's other organization that come here literally, like I got scammed from a nonprofit organization that I'm battling now, that I wrote to the patient advocate and they don't even want to hear it. So if they're not vetted, how do they get there? Because I haven't got an answer from anybody. I wrote and I asked, can I open a nonprofit organization? I just come to the VA and do whatever we want? Or is there a vetting process that everybody comes in and register and provide services? So I think if anybody can give me that answer, I'm all ears. Okay?
Yes. Thank you. Any other public comment?
This is Tess Benko with the Veterans Collective. I did send an email requesting to present on the community plan and the principal developer team's work alongside the VA in developing the largest housing community for formerly unsheltered veterans at the West LA VA. We are the entity that was competitively selected by the VA to carry out the community plan. So I'd be honored to give a presentation to you all on that. I'm also a Marine Corps veteran myself and a social worker and public administrator. So I'll look forward to that. And I also did put into the chat for the last question, there are at least 2 entities that approve community approval processes. So VA Center for Development and Civic Engagement and VA Land Use. To my knowledge, working very closely with them, intimately with them actually, unvetted nonprofits and those who donate to VA programs are not supposed to be accessing the campus. So if there's a question about that with your program, if you're in CTRS, feel free to ask your program leaders and report it. Because unfortunately, we're going to see more and more of this with the campus community continuing to grow and having more veteran residents. Additionally, the Veterans Collective does have its own vetting process. I am responsible for working to vet community partners and services and amenities partners as they come to fruition and things are being planned out in accordance with the community plan, which also incorporated a lot of veteran feedback amongst years and years of veteran feedback, town halls and different events and the like. So I'll be glad to share that with you all at the next meeting if that's when you would like us to present, but very glad to be here with you today. Thank you.
Thank you.
So anyway, hi again. I really love the gentleman sitting next to the director. He actually brought a lot of very valid points. Can we really make sure that it doesn't have to be even if the director doesn't want to come, because according to the schedule, it was supposed to be before 8. We were supposed to do Department of Military and Veterans Affairs report. I don't know if we did that already, but I would think the VA should write their response. So coming here, maybe they should write their response, and then that way it's written, and then we can actually present it to like on number 7. So y'all will present whatever the VA said to us, and then because there, like he said, there's going to be a community up there. Personally, I don't think families should be there yet because there's a lot going on up there. There's a lot of it's a community trying to be built, and also further several points made here, the National Forest Service would be a better ideal at doing this because currently excuse my language, it's a clusterfuck up there. You got areas that are being constructed, and then they got all types of activity going on up there that shouldn't be going on up there. So it should be done with a department, the public-private corporation is a better situation going forward. And maybe if this board, because you are a board of something, you're commissioning, so maybe y'all should really push this public-private and show VA how it can help. And you already have an example at the Presidio situation up north. So we don't have you have the work that's been done. It's not like we got to figure it out. It's been figured out already. If you have success one place, if VA sees that they've been successful and y'all really start pushing it, I'm talking about putting your foot to their neck, they will approve it because now it's taking the responsibility off of them. they do have other things to worry about, like the mental health department and the physical medical side. They have a lot more to worry about. Maybe the county should say, hey, you know what? The county can take a lot of this off of you if we're through this public-private partnership we have. Because it is the federal government, they'll still be funding it. You just do the footwork now. Get it off their books so they ain't got to worry about it because now they can give it to the county. The county services a lot of LA, and you got a lot of veterans in the county. So this commission should really show the VA, the federal government, hey, we can do this because California is a better testing state. If it can be done here, it can be done across the nation. So let's make LA County look a little better through this board for veterans because Trump is in office and he likes his veterans supposedly. So instead of getting our budget cut, let's get our budget funded. This is what you are doing. Y'all just started. Thank you. Appreciate
Thank
it.
No other public comments. We can move on to agenda item 9. That is Commissioner announcements. Commissioner Crooks.
Though it's Black History Month, just want to call your attention to the fact that because of the Eastern Fire, just a moment of silence, taking into consideration the largest public Black housing was the Nickerson Gardens. The man who brought that to fruition, his family had a home in Altadena. His grand, I thought it was, for some reason I thought he had died. It was his grandson. I didn't realize it was that long ago. He actually had found a Nickerson garden. So his grandson was the one that died. So just keep that into mind. Thank you. Now I'll pass it on.
Commissioner Paul Merrill.
Thank you. I just wanted to again thank our veterans who are here today, especially our veteran women. It's really great. The VA, I started that campaign, I think like 6 years ago, that this is what a veteran looks like. So it is so great to continue to hear the growth of that statement and our veteran women really leaning into that. So I just wanted to thank our veterans for, number one, speaking up, being here, being present, and also just this pride that they have in their veteran status. I also just wanted to talk about Supervisor Solis is having an event in March, and it is, hold on one second, it will be taking place March 21st. It's a Friday from 9 a.m. to 2 p.m. Admission is free. It is called the LA Veterans Resource Expo, and it is our 4th annual Resource Expo. So we are just excited to have everyone come out, veterans, reservists, guard, active duty, military families, caregivers, community, bring your service dogs. It's all good. So we're just excited to have everyone come out there, and just continuing to just be glad to be able to continue to serve our community, continue to serve under our amazing supervisors who are just doing such an amazing job, and just continue to see the effect of the things that we do and continue to do. So I just want to also thank my fellow commissioners for just being amazing and being passionate and helping us to be a powerful group so that I'm never ashamed to be a commissioner, but I am proud to be a commissioner and I am proud to be part of this group because, there's a saying that says, if you tell me who your friends are, I can tell you who you are, or something along those lines. So thank you.
Commissioner. Commissioner Jackson Kelly.
I want to recap some of the things that has happened since this is Black History Month. I would like to say Happy Black History Month, and it's something that I will continue to acknowledge. I think this is the first year since I've been a commissioner that we have not had an event at this facility, but hopefully that won't happen again. And I attended the budget hearing virtually as stated, and I found it very informative, and I'm glad that I was able to participate in that. I also attended the Heritage Foundation breakfast that was held here. Unfortunately, I wasn't able to stay for the presentation because I didn't realize they were doing a lot of other activities before they had the presentation. So it appeared to have been very well attended. The room was packed, so I was glad of that. I also attended the hospital salute that was done at West LA VA Hospital, and I was very pleased that the veterans participated in that. It was held in the multipurpose room, and it was um, full of veterans. They gave out produce and eggs, and the veterans were very happy to receive that. I also participated in the Martin Luther King parade that was held on Monday, and I was with the Black flight attendants, who has been around for 50 years, but very few people know about the organization. I also went to the breakfast prior to that, and I was able to share some words with Attorney Benjamin Crump, who was the Grand Marshal at the parade. Um, I am scheduled to be the keynote speaker at the Pasadena Community College Black History Program on February 25th from 3 to 6 p.m. And they will also be showing the 6888 movie. Thank you.
Thank you, Commissioner McFadden.
So on January 25th, there was SD2 had its town hall. Supervisor Mitchell was in attendance, which is always wonderful when the supervisors are there because it allows the community an opportunity to speak directly. You don't have to go through all the people and all the resources. You can hear it straight from her and from your ears, from your mouths to her ears. Um, One of the things that I wanted to encourage everyone is that we have these town halls on a regular basis in different districts. And as Mr. Wong and Mr. Moore and Miss Maines, I think was the name, were speaking about communication. It's important if you're not able to come here. We do have opportunities to speak directly with veteran servicing organizations and organizations that are wanting to help and provide insight, help, assistance. And it's unfortunate that I feel sometimes we have these opportunities and it could be the location. So if there's a better location for you, let us know. But there's a lot of time where there's an overwhelming number of organizations and no veterans. And that is a problem that I'm hoping to pinpoint why that is. And it's maybe moving it around, moving it to a location that's more accommodating. We've done time changes, we've done location changes. We've done everything that we can think of, but we need your input as to what can be more helpful for you to get the information, because we definitely want to be proactive, intentionally actionable, because having a town hall with no attendees and no veterans is useless, right? The information is there. We want to connect you all with the resources. We want to make sure that we're being held accountable for what we're hearing in these spaces and providing those opportunities for you to connect directly with what you need. So I encourage you, when you have these moments, as Commissioner Palmero indicated, there's these town halls, there's all these things, to please come. The information is also posted on the websites. So if you're not hearing it directly from your commissioners within the districts or from any of us, it's on the website, and we'll try to be more communicative to you all as we're servants, we're public servants. We're not here to do anything else but to do what we've always done, is to serve you all. So that my other point is that I know that sometimes we use a lot of acronyms in here. I get confused on half the acronyms that we use. So as we're talking, if we can just be intentional about spelling out what some of these things mean, because sometimes we may not know what they mean in the acronym term, but we know when they're spelled out or spoken out. clearly it makes more sense to us. So just a reminder as we're having that communication to people to do that. My third thing is to talk about or to gain information about VA hospital partnerships. It came to my attention recently, and I don't know if this is a future agenda item or whatever, but I just want to put it out there that I did not understand. I didn't know that our Long Beach VA and our West LA VA, I knew there was a disconnect, but I didn't know how bad that they did not partner. And so if you are a veteran who is seeking services at one hospital and you're unable to get a close appointment, or you know that there's a specialty in another location, they will not allow you to transfer. You have to move your entire profile to that next hospital. And that's really, really unfortunate. So it's something that I'm looking into because I don't understand where that breakdown comes from and why it's so disconnected, because veteran servicing is veteran servicing, especially within the VA system. So if anybody from the VA hospital is hearing this information, know that I'm coming to talk to you. Please call me. I want more information. And last but not least, I wanted to welcome Commissioner Edmonds because hello, we didn't welcome you. So welcome.
Thank you, Commissioner. So that was, you stole a little bit of my thunder. So we got rolling a little bit early, a little fast today, and we didn't acknowledge Commissioner Emmons. He is joining us. This is his first commission meeting, and he is from the 3rd district. So welcome. Now, Commissioner Fulmer.
Yeah. Welcome, Commissioner. It's good not to have a vacant spot too long. A couple of things. Building 306 at the West LA VA. First and foremost, I do appreciate all the attention on West LA VA, as all of the constituents from the 5 districts or all of the veterans in West LA VA reside in each district. So it is a county-wide situation, not just an SD3 situation. And I do want to talk about Building 306. The soft launch was done on January 27th, and it is open 5 days a week. It is Monday through Friday, 10 a.m. to 5 p.m. And on Wednesdays and Thursdays, it's actually open till 7 p.m. So I'm excited about that. I'm there most times. And the reason that that is so important is, number one, the VA has done a tremendous job in releasing this to the veterans and partnership with the veterans, turning this into a peer center. So, I do give a lot of appreciation where it is due, to the point where our first major event was a Super Bowl party on the VA. And the reason that is such a huge deal is because they allotted VA staff to be present to allow this building to open on a Sunday. So I think we're making strides in the right direction. It's to the point where, the smallest of situations are big, like streaming internet services. We have made the determination that that won't be done at 306 using the VA streaming services, because, well, March Madness and football and all that is important. So I'll end that and just really encourage anybody to make it to Building 306. Um, Two other issues, 2 other points. One, this is more than lip service at this. It was just a little over a year ago where Director Zenner announced the support and the attention on Building 306, and it started here. So it's really, really important to look back. It was recorded on our sessions to see that movement can be slow, but it is progress, and we are going in the right direction. And it started in Bob Hope Patriotic Hall, which is where I want to end this and say that Bob Hope Patriotic Hall was noted at the last California State Historical Commission to be recognized as a state historical museum. And that consideration, I had the honor of speaking on behalf of it, speaking on how Bob Hope Patriotic Hall has sprung into action to help veterans and continues to do this. I was quite nervous delivering my little speech. I don't typically get too nervous, but it was an issue that was close at hand because I was evacuated from the fires as well. So I'm really, grateful for all of the public comments and the consistency of attendance, even in light of last month's commissioner meeting being available virtual for commissioners out of state like myself. So thank you everybody for your participation and engagement in the county that is doing its best to pay attention and help resolve these issues. Thank you.
Thank you, Commissioner. Commissioner Emmons?
Thank you also very much for the warm welcome. I'm happy to be a commissioner now. And, you know, as I look around the table, I see a lot of concerned commissioners from their own districts about issues that are near and dear to our hearts. And I believe we have a lot of work to do together. Whether it's about the reduction of diversity and inclusion that's occurring within veterans, because as far as I remember when I was serving, it was the most diverse group of people I had ever been around. And at no point in my life did I ever think it was only one shape or sex or color that was serving our nation. And when I think about all the community growth that we all need to participate in so that we can bring veterans together at a higher level, whether it's in our own districts or specifically at the West VA campus, because that will be soon the greatest concentration of veterans in one small area that we have seen since the original 4,000 veterans were kicked off of that campus in the 1970s. I'm just really looking forward to working with all of you to apply correct pressure so that we can move forward and provide the best possible services and conditions for our veterans in all of our districts. Thank you.
Thank you, Commissioner. Commissioner Noyola?
I just want to echo welcome to the commission, Commissioner Emmons.
Thank you. So that's it for commissioner announcements. So we are at agenda item number 10. So adjournment. So thank you all for coming again, and we will see you next month. We are adjourned.
This has been like the longest meeting.
In a while, huh? That was long.
Thank you.